all the public healthcare infrastructure has been completely affected. Many of those structures had been literally bombed, and the remaining ones are absolutely non-functional. There's a lack of qualified staff who had moved inside the country away from the more affected areas. There's certainly a lack of supply, there is a lack of equipment and drugs. It's very challenging for the population. It's already people who cannot easily travel. There is insecurity, for sure, but there is also a problem of having the money to pay the fuel for transport. I remember a pregnant woman suffering from placenta previa. She had started bleeding up there in the village, and it took her more than 48 hours to reach the hospital because her family was trying their best to put together some money for the taxi. She came in a very, very serious condition where really she was about to die, and even entering into the OT was not granting that she will survive. We understand that there's money funding humanitarian assistance and response in Yemen, but today we don't see it. We don't see it translated, meaning that the population we are caring for in our hospitals and the hospitals we support, other health facilities, when you speak with people and patients, you don't hear and you don't see the injection of that humanitarian aid. We don't want to undermine, that pledge, but what is important as well is that we have a better understanding of what are the precise needs and what are the mechanisms in place for this money to become real for the population in terms of assistance. Because again, it seems that the funding is there, but this is not reaching the population. MSF is one of the very, very few, if I can say even the only one, that is outside from big towns providing healthcare. It's a massive operation for MSF. It's almost 2,000 MSF people on the spot. We are working in 13 hospitals and health facilities. We are supporting 20 others for active conflict. Today, since 2015, Yemen is the major MSF operation. MSF today has been treating up to now more than 72,000 war injured. It's something that you don't do every day.